Okay. So, hi everyone, nice small group. So if folk do want to come in, I'll try and keep an eye on the hands and just interrupt me. But the plan I'm going to try to do is, if we move to the next slide, is what I think I was asked to do, was just to explain generally around GM in terms of the approach we've taken over the last 5 years of trying to move things on and pull bits together in line with, I guess, the stuff we heard earlier on, because the trick is connecting a whole bunch of the transforming care, building the right support, mental health, and youth justice bits together, and we've been trying to do that because of GM. So first of all, if I just introduce it myself, so Sandy Bering, I'm a consultant psychologist, been employed, I guess, almost the same length of time as Chris has, so about this 40 odd years lark. So I've been through a lot of these changes, and I remember the Children's Mental Handicap Hospitals, and I will reference back to that. The key bit I think that I'm asked, I suppose, to talk about is as the lead commissioner across Greater Manchester. So I am the lead across all mental health disabilities across the board, including youth justice, veterans and other bits. So I can actually connect bits together, monies together, which again gives me a privilege. But I guess with devolution, with GM, I guess everyone is moving toward that sort of approach of an ICS and that sort of footprint. So GM, we're about 3 million people, 10 CCGs, several trusts and bits and pieces, so big organised, big sort of area, about £6 billion plus of spend. So we're a big area. So I'm going to try and pull out some of the key lessons and get through. These slides are going to come out to everybody, so don't worry, there's loads of words. They give me protection assurance more than anything else. That's all they are. So if we move to the next slide. So GM's lucky in the sense that one of the bits, because of a lot of work folk have done over many years, and a lot of what I'm going to present isn't mine. I owe an awful lot of to loads of other people, including particularly the Lyndene bit I was asked to present, Sarah Austin, Paul Marsh and others in Manchester City Centre. So we if you look at the variation in terms of children's admissions around to our CAMS tier 4 beds and stuff, we're in a privileged position, and we've kept to that position for quite a long time. Now, just because we've got that low position does not mean we don't have our challenges, and that's the bits I want to get into, because the number of people in a hospital bed doesn't really capture demand and placement failure and challenges that folk are dealing with. We still have large numbers of kids presenting around our A&Es and into our paediatric wards. We have a large number of kids going into residential care, and really you won't see much difference in terms of sometimes the care they're having there as opposed to it would have been in a hospital bed. So as far as we're concerned, just because we were low on those numbers, that ain't the end of the journey. And for no other reason then it's nearly crippling our directors of children's services. Our funding, as was said earlier on, is absolutely mad in terms of those figures. We've got care packages at the moment. I think there's one in Salford is 21,000 a week at the moment. We've got a couple in Wigan, which are about 32 and 48,000 pounds a week. So when people were hearing this business about this completely breaking our system, we do need to keep an eye on that, not just numbers. Next slide. So really important is, because of some of these problems, it isn't just us who've been facing it. Our neighbours next door in Cheshire Mercy were facing some real concerns, and they had a particular case they worked through. And on the back of that, they did an audit, which then mirrored what I think we found across the country, and certainly in GM, that, you know, a large number of the kids that are going into these beds. So today I've got 8 children for my 3 million population in CAMS beds, which is low on the numbers, but 7 of the 8 are autistic only girls. So there's a real issue around what happens to the boys, and the boys tend to end up going down more a secure path, so get into secure welfare placements and youth justice. So there's a real issue around this one, and there's a massive overlap around trauma, around mental health labels, around, you know, how the number of kids in looked after sort of homes where placements are breaking down. About 50% overlap is what we find. Multiple labels for these kids. Next slide. So for us, what come out of all these reviews for us is massive fragmentation. The whole point for us on devolution was for us to try to bring things together, but this is what it feels like to families, and it often feels like it to us as well. It's a mishmashed world, and certainly at a local level. Next slide. And so one of the things we just commissioned, which again I think is a really good piece of work across the Northwest, is a full-scale review around CAMHS, and it did specifically picked out that kids with learning disability and the looked after kids were particularly vulnerable and sticking out, and certainly in the last 6 months to a year. That's really come through even more to the fore. We knew it was before, and some of these bits I've highlighted in red there for you are really are the issues that we need to tackle, and I think they're sort of relevant about how we organise our response to them. So they absolutely, you cannot do this work without doing the work around mental health, around looked after care, thinking through the youth justice system. Keep going, next slide. So we know, and if you just keep clicking on these, we know what it takes. This is not bloody new. One of the bits around these conferences we go on, that all this stuff keeps coming through in terms of what we're supposed to do. So again, a load of words there, but one particular one I want to get to at the bottom is you can make change on these. Me as a psychologist used to do this years ago, but it isn't just the technical bits you do around kids and supporting families. It's the emotional and the practical support you've got to give them as well, which is where the respite and the help people need in terms of repeated, say, broken toilets, bed frames, other bits and pieces. We've got to be very practical to families and supporting kids that way around. And I'm not meaning all families are good and great. So I think one of the bits I also worry about is that sometimes we pretend on that basis and we forget some of the abuse and the trauma that's going on as well. So I think a lot of families trust me that I get away with saying that out loud. Some people don't, but I do think we've got to go with some honesty about why kids find themselves in challenging situations and how difficult it is for them to be supported. Keep going, next slide. So this is a slide from Viv and others at the Challenge Behaviour Foundation. Again, loads of material out there. They've just done a video this week. Nothing of this is new to us in terms of what we're trying to do and move towards. Next slide. And again, I've been around this lark too long, and you're seeing here a range of reports and of what we're supposed to do. What doesn't happen though, a lot of this in that sense is common sense, but it ain't common practice. And the bit at the end is there's some really good stuff that's been done together by bringing us together in terms of that family survival guide, very much led by families, about what works for them, what doesn't. All the bits above there are bits of programs right the way through to aiming high, giving practical respite and support to people. What Jim said in terms of the repeated Mansell reports that he did, in terms of what people should have done. One of the best reports you can't actually get now, I think, in terms of the digital stuff, is Don't Forget Us. Around now, 25 years nearly ago from the Mental Health Foundation, which spelt out for this group of kids what we needed to do. And I'll bring you back to Anne and Gary's work in Los Angeles at the top there, practical ways that people have been showing what to do, but we don't do it. Next slide. So nationally, you've heard earlier on today a load of those headings, and I find it fascinating just keeping up with the headings and the structures that our national team will give us, and we've got to keep an eye on those because they'll be our monies. But there are 10 things here when you've got time to look at them. This is the things we're judged by that we're supposed to do with that money. And what they're particularly asking us to do this year is to target youngsters in that 14 to 25 category, because that definitely is an issue. So again, I should point out our numbers in GM are low up to 18, but 18 to 25, they splurge. We have a real breakdown. That comment earlier on that schools providing the scaffolding and keeping kids going is a really important point on that. So we are supposed to be using some of the money, and I'm going to tell you how much money I'm doing and spending, and you can work out what your proportional shares is, because everywhere in the country is getting that money. Is that bit at the top around those intensive sort of teams, putting a substantial offer around autism is the second bit, real issue around targeting reduction in those preventable admissions. Keep going, next slide. There's bits around the offer around the dynamic risk registers or systems, whatever we want to call them, the bits around our CETRs, the planning, doing that Ealing model, and I'm going to come to that again in terms of bits and pieces. So the bit at the bottom there, short break services for people. Some families are just knackered. When I did my clinical training, I did a really simple project. I just went and interviewed families of folk who were challenging and families of folk who weren't with learning disabilities, and basically families of folk who were challenging were knackered and they needed their kids to go somewhere to have a break, because the personal budgets type of some of those bits, actually they just needed a good night's sleep or a night out together as a couple, as a family. So there's some real practical respite that isn't there for these difficult challenging kids at times, if you know, the ones that get labelled that way. Anyway, keep going, next slide. I promise I'll finish on slides as soon as I can, but this is the judgments we're being told. So I've literally cut and paste from the guidance as to what you're supposed to do, so you don't have to read loads of it. But that last one is important there as well, that while we do it together, we do need to align these agendas. Next slide. So in GM, the line we took a few years ago was basically saying we needed to break this work up, and we basically chunked up the number of kids who are challenging, a number of adults who are challenging, and saying, look, we've got to put these services in. We did need to do that work. And one of the reasons I can probably do more of this work than some of you might find is we put in that team at the top, a special support team, about 2 million quid, 40 extra staff across GM with Merseycare, and we targeted initially adults. So for me, while I've got that in place now, the new monies I'm getting allows me to put on those gap areas, which are principally children and young people and particularly autistic non-LD folk. But if you haven't got the bits at the top sorted, you're going to have a problem in the sense because you need to use the money for that as well. So you do need to know what your position overall is in terms of figuring out how much money you've got compared to, say, what I might have. Next one, next slide. So in our children's programme, we just chunked it up and we thought this is a bit of a jigsaw. So what are the bits we need to do? And basically you've got 7 bits here because you do need to chunk this work up. And we do need to think about the bits that Phil and Sue put on earlier on, whether we need to chunk it up the way they've suggested around the identification around autism, whatever. But we use this as our headings. You might use something very different, but we just thought they do fit together. Key workers with the Ealing model type stuff with the registers do fit together, but you do need to chunk up your work because it gets really, really messy and complicated. Next slide. I think it's just a messy slide. It's got stuck. Is it stuck, Fiona? Can you move it?
It's just stuck.
Sorry.
Here we go.
Okay, so again, one of the bits that you need to do, the next slide, is basically how do you organise your work? So the way we do things in GM is we've tried to chunk it up into this sort of headings. So we do link up both into our children's mental health board principally and our LDA board. And there's a reason we've done that. Is one of the lessons from the talking to Catherine and others in the Ealing model stuff is having the link back particularly to CAMS, and the CAMS wider work that we're doing is really important. So that's why we link into both those boards and it's seen as a joint programme. So we are putting into all 10 of our localities that sort of Ealing intensive, both therapeutic and short break service and support. And that's where I'll come to the Lyndene bit in a minute. And it basically in cash term, what that relates to is just over £1.5 million a year. It works out. It's going to be from the monies I'm getting. And as I said, every year in the country's getting that money. It's just I'm choosing to spend about £1.5 million on that, adding to about 25 different clinicians is what we're out to recruit and trying to get. Are they out there? That's going to be our big problem. I don't think they are out there. We haven't got a workforce. We've not been training the last 15 years people to do that work. So we're going to have to figure out creatively how we do that. But you do need to get the money to do that. Second big chunk is the key workers bit. So the key workers match up with that. So when Catherine and folk were doing Ealing and folk in Hounslow or elsewhere were doing the bits, they didn't have the key worker ID. So we're heading towards 40 key workers in GM for the money that we're getting. And we were estimated from Jim Mansell's, from the Pansy, from the other work, it's about 450, maybe 500 people, children, young people at any point who are challenging. A smaller group of those will be the ones worked with that intensive Ealing model type stuff, but all of those 450 people should have key workers. So we tried it doing by small locality, it didn't work. So we're doing this as a GM-wide tender, and literally I think it's tomorrow they're making the decisions of which agency have got it. I was surprised. We put it out to tender and we got 4 really good bids. So that's going to be in place. It heavily links around your risk registers and knowing who the people are out there. You know, it shouldn't be a shock just asking who's challenging, who are people struggling with. But again, that's the 400 people who get allocated key workers. That's why that element is critical. That's where you come up from your people who are more red-rated, who get the Ealing model bit. So you can see how this all connects together, the CETR's work and then the autism specific work. So again, in London, they kicked off an autism service. And so for us, there's a heavy bit around that diagnostic and post-diagnostic offer. We're trying to figure out how many people can get with an easier model. And then there's a much wider training support program. And the box in pink you've got, Barry, it's not just our work alone. A lot of our kids end up linking around the wider autism mental health hubs we're doing, the violence reduction work we're doing, the complex safeguarding and the trauma work we're doing. Does that make sense to people? And I'll give people a chance to come back on questions in a second now. Keep going, next slide. Okay, so that's what we're spending, how we're organising ourselves and spending our money. So if I just go through a few slides on the Lyndene bit, which I was specifically asked to talk about. So I think that's the next bit coming up. So Lyndene basically is one of our 10 localities. So Manchester, the city centre bit, covers about 20% of the GM population. And they have been doing a load of work for several years around with the risk registers, around working around particularly the youngsters around the autism bits. And so they committed that this was a real gap for them. So folk like the Director of Children's Services in Paul Marshall, Sarah as the strategic lead and others, they came up with this idea. It's not from us, and it seemed really logical. We do need somewhere where kids can go. Next slide. And they basically, again, organised themselves. And I think I was asked to say, how do you do this stuff? So they organised themselves in terms of figuring out what was the element that was going to do the professional support in this, what was the bit that was going to go for the breaks with people and the bits around the personal budgets. Next slide. And they've tried to think this one through very much like Ealing, that it will offer practical help for people. Their version of the Ealing sort of team, a model team, will end up building around there. They're going to try and work with about 80 families. Now, that's on the high side compared to what Ealing suggests. Ealing suggests that you should primarily work with only about probably 6 or 7 kids at a time for a 300,000 population. So the way they're going to get around that is they're putting some of their own locality monies and investment to beef this up, because they recognise it's actually a logical investor save bit, which is what Ealing found as well. Local authority carried on paying for psychologists and others for 14 years because they basically saved them money. Next slide. Again, nothing fancy in this stuff, hopefully, that you'll see. It's all stuff, hopefully, that you guys agree with. And very practically, we're trying to figure out, well, doesn't this make sense going elsewhere? Next slide. And on the basis of that, we negotiated with NHS England to put in some extra capital. So they were given about £1.5 million extra capital to beef them up. And we're doing another building, and we think we might need 4, in effect, Lyndenes, a Grace's Place and others across GM to do this, because we don't think every locality, all of our 10 need it, because there aren't enough kids, but we do think there's a real demand on it. Next slide. And that just basically is the process they came up initially with for thinking how kids will get identified working into it. Next slide. And why this slide? I wanted you to be aware that this is so similar to the work and the thinking we're doing nationally and otherwise around looked after kids. Same model here, called No Wrong Door, came from North Yorkshire and bits. Very simply, this idea again, put the therapeutic support in, work with a small number of kids, provide bits of right coaching, have some emergency bed options, and provide bits of breaks and provide that outreach. Doesn't it sound a lot like the bits that we talk about? I think someone in the chat and earlier on talked about, well, why are we saying autistic kids only? My angle is there's a lot of needy kids with complex needs that we need to support. Some of the models appear incredibly logical. We just call them different things. Next slide. And in terms of to support this, though, you do need the clinical support. So again, there is a large amount of money going in via me and NHS England into our children's mental health programme. And again, we've spent about 15 million, 20 million quid the last 3 years into building up those elements in the middle there. And we're lucky that we've done that, because we just listened to families and did that. So the bits on the side is the next bits that I'm adding in there, building on the safe zones, which is VCAC alternatives, crisis paths, those options, thinking about other residential services, which links into like the Lyndene bits, some hubs, and the intensive support. What we've learned is kids need help. Some kids and families need more intensive support longer than we thought in terms of our rapid response teams. Next slide. And you can't take this away. As I said before, the names at the top are changing in terms of who now runs those services. North West Boroughs no longer exist. Our probation services become one again. But basically, the work is the same. You know, 1 in 10 of our kids presenting through custody are often these kids with complex needs. And so the work you need to do on the right hand side there around trusted relationships and your wider programs around youth justice becomes very important, particularly speech therapy, you know, particularly communication difficulties. So about 70%, remember, of yacht caseloads are kids with literacy or communication or learning disabilities. So there's a real obvious bit there. Next slide. And I think we're getting to the end. So this I just threw in yesterday is one of the bits I'm just about to do is to check now where each of my 10 localities are up to. And this is just an honest bit around our adult one from a couple of months ago. I mean, some of it's improved again since, but we came up with very much on the side, here's what we think should be in place in every locality and or across. Where are we up to? We use this model all the time to get it open because I think you do need to, it's not embarrassed, but you need to nudge the system to move on this, to work it through. And so we'll have an equivalent for kids, but I just thought you guys might want to think about how you track putting those ingredients in. And I think we're coming to the last slide or two now. So these last few slides I just put in for you to as links so you can use them when you get them, is other models that have done in effect the equivalent of the Lyndenes and that we're recommended to think about. And I think they're okay. So the Nest is one down south. Again, there's a link there, how Kent Council have developed and worked that one through. They vary in how long they offer kids to be in there. This one does about 10 weeks. I think the next one is the one up, is it the Beehive in York, slightly different in its approach. But again, people trying to do the same sort of stuff, thinking through the therapeutic short breaks with the other bit. Next slide is, I think, just links. Extended Hopes is a service in Surrey Borders, where they came up with kids that were coming to A&E and providing a physical place that the trust provides for up to, I think, 2 weeks in that case. We've done a similar one, adults, worked really well with Xenos as a sort of a private provider, provides that support as well as an alternative to hospital, because it's not a great place for kids to be in paediatrics or A&E. Next slide. And obviously the Ealing model link as well for you guys, just in case folk hadn't seen it. You can find the connections there with Catherine and we can share all the slides and other bits as well. And I think all of these finish with this last slide. Is it please be? Yes. So if we leave this one up, this is what keeps coming across all of those models. And when you look at it and what families and folk keep telling me of what I need to commission, order, organise. And I thought maybe that's the conversation we have with you guys now, is to say, is this making sense? Is this not? Because how you will organise your response, your traffic light type system will vary in each of your areas. But I wouldn't have thought you're not going to have to put many of the same ingredients as I've tried to do there, but it's not easy. So you do have to chunk this up, our work. If I stop there, Fiona, and I'll open it up for questions.
Great, thank you so much. Would you like me to leave this slide on or stop sharing?
What do you think, people? Do you want to see people's faces or should we get rid of it?
I think it's probably better to get rid of it if you want to have a conversation.
Yep. There you go, we'll go with that.
Sorry.
Okay, I'll put my camera on, but bear with me, my Wi-Fi is dreadful. Okay. Anybody want to ask questions, or are you all happy with what we're doing? Because I think that's what we're all being asked to do.
From my perspective, I'm not a commissioner, but I'm a DCO in Norfolk and Waveney, and it sounds like there's a lot of things going off similar across the country. Like you just pointed out, really, I think what I struggle with is a lot of these points have been raised over a number of years, and it's only now people are starting to get to grapple with it and start to put something in place. And so I'm hopeful that things will improve over time once things do start to get in place, because it's about people have known for quite a while, but the actual either it's financial or it's been there's not been the drive to move it to where to get to implementation. So I'm hoping that things will be implemented and that we'll start to bring some change.
And Mark, I would say this from a GM angle, we do need to remember these are our kids and therefore it's our money together. So if we've got our local authority colleagues facing 10% cuts and reductions next year, I can't afford to ignore that. You know, I'm going to have to work that one through. It's our collective money. We'll have to do this together. And I think that's the hard bit sometimes of people recognising it's not blaming, it's actually trying to do that one through.
And I suppose I'm also a little bit hopeful that the ICSs might actually also drive some of that agenda too, to try to join up to be like joint owning the system around the children and families and young people and adults, whatever we're working in, to start to look at where the system is needing to make some changes to work together better, to use those resources more effectively rather than these silos that's been going on for a number of years.
So that's the intention. I suppose it might be interesting. I don't know if people are on from the provider collaboratives. I think there's an advantage. I work really well with me trusts and bits, but there is a danger, I guess, with provider collaboratives that they could end up focusing NHS inwards rather than outwards. And I think that's maybe some of my anxieties. I suppose I'm able to look across right the way through. Any other questions, or is everybody happy and we've done this workshop? No, Jess?
Hey Sandy, thanks so much. That was such an interesting presentation. I'm just interested to know a little bit more about the staffing or the proposed staffing model at the Lyndene Centre. Because certainly we're looking at doing similar things, but one of the struggles we're having is about how you make sure you have I think on your last page about what good looks like, it talks about having appropriately skilled and trained staff, but I think that's been a block for us certainly in the past in terms of private providers and the skills and experience of the staff who might be dealing with some of our most complex young people. So I didn't know if you could just give me a bit more information about that.
So can you do that as a request, and we'll send the details to you. So I think each of the models are going with slightly different variations. So for example, the Grace's Place one I'm thinking at in Bering, they've come up with a model which I think is the first stab at it is too clinical, if I'm honest. I think this is more folk who are skilled at working with really, really complex kids who can really annoy you and challenging. So to me, it's more our residential old social work skilled experience. It was interesting having that talk, wasn't it, from the interveners with someone with a social work experience background, and you do it. I only learned this as a psychologist, I'll be honest, doing it hands-on. So I learned an awful lot about working. Say, I used to organise and support around 15 homes. I'd go in every day and work through, and you'd have to reframe it and work it through. So I think it's sometimes we can overdo the staffing numbers. So sometimes the young people and or folk will tell me they feel overwatched. There's people just waiting for them to do something wrong. Space, I think, becomes dead important. I've got an older people's program that runs actually on a quite low staffing bits because it's got the space for people. A lot of our newer buildings aren't really well constructed on that way around. So happy to share the details, but following those links, you'll see each one I think is approaching it slightly differently, but it won't be any shocks to you. I think the big shift in those from our private sector ones we buy from providers is they call them therapeutic. We pay a lot of money into them. I'm not sure. That package I was telling in Salford, it's interesting. There's having to be, say, one of the nurses is having to go around. We're having to pay for extra time to role model around it. So I think the trick is having people who know what to do. I trained up people nearly 30 years ago around this, and I inherited, I think it was 4 porters, 3 housekeepers from the old hospital we closed, and they actually were really good at the stuff if we taught them, and they were on the old band Bs. So I think you can do on band 4s and 5s, but you need people who are used to doing this. And I think there's a whole bunch of good skilled youth workers, residential ones, rather than clinical in the main. The clinical we can add to, but I'd always say recruit on attitude makes more sense. Does that? But we'll happily send the bits through, and you can follow the links through. You'll see each one's slightly different. It's not that fancy though, that you'll be surprised. It's the bit around it that's needed. I think is that people need, and to be able to top it up.
That's great. It's really helpful.
It follows on quite nicely. Thank you. That was a really good presentation and really helpful overview. That so I'm based in Hackney, and a really new challenge for us is just a challenge to recruit, which pre-pandemic was never really an issue. I don't know if we've kind of been impacted by the mass exodus from London and things, but we've just gotten funding for a kind of pilot of a service similar to the Ealing model, but unfortunately we just haven't been able to recruit to those posts. So that's a really new challenge for us, and I think any advice that others can share kind of in the future would be really helpful, because that's actually kind of hampering us delivering our pathways an awful lot.
I mean, that's the honest truth, if I'm honest. I had almost about 80 million this year around to actually spend around mental health, LD and other bits, trying to recruit 700 staff. They ain't there. So I think we're going to have to really think laterally. I think the schools one, mental health in schools one, is an interesting one, because we are getting, for example, to there, for say the Bolton Wigan bit, none of those were from our existing services. So they were a lot more psychology grads and other bits and pieces. My anxiety around psychology grads and being a psychologist myself is there's loads of them, most popular degree, and everyone seems to say, oh, can we use them to do IAPT, all the bits and pieces, is they may not be your most practical folk, if I'm honest, around this bit. I found some of the skills we needed were good parenting skills around it, maturity and bits. And so when I was younger, I wasn't necessarily the one who knew how to figure that out. So I just haven't got an obvious answer to you with that one, other than we ought to pay people a reasonable level. And I'm not trying to sound like Boris today on those bits and pieces, but there is something about we did go very low on our wages and then we're surprised around it. But we paid an awful lot to the providers, sometimes the private providers, but that money didn't get through to the direct staff. So I think that's one of the bits maybe we need to think about. How do we offer that certainty and the bits around that? But I haven't got an honest answer to that one, Ellie, because
that's why I didn't think you would. It was just to kind of raise that that's been a really new challenge. It was never an issue.
Yeah,
but, particularly on the higher bands is harder.
It's really hard, and I think that's the bit for me. We're going to have to grow our own. So I do think we need to start now with thinking that through. That's again the school analogy. Our mental health school support teams one. We're now training up those people at band 4s into 5s, but straight away I'm now planning through. Okay, how do they then get through to be your 6s and 7s? So the only thing I'd say to you, this has gone on for years, hasn't it? So it's nothing new. I think Mark said it earlier on. We need to plan this over the next few years. So this needs to be a 5-6 year strategy bit in terms of giving ourselves a realistic chance. But sorry, a good question. If anybody else wants to answer that one, that'd be brilliant.
Thank you. It's just a kind of comment. Thanks.
Any others? Comments, queries, issues? Or really happy to run this workshop quicker, Fiona, than it needs to. Fiona, you're on mute, I think.
Oh, sorry. I see someone's typing away.
There's evaluation questions, aren't there, Fiona, in terms of saying to people, okay, how do you do these bits, pieces?
Yeah, I mean, we literally, so Gemma's just said, really interesting, thanks, absolutely agree about considering what staff are being paid and how to attract more staff into roles.
So can I just finish then with people, just a few bits of money bits for you guys to think about. So remember, my population is just under 3 million. So I get a population fair shares basis. You will have your equivalents to that. So you can basically divide it by however many 100,000 new population is. So I've got this year about 1.3 million for my community grant that was referred earlier on, and it goes up to about 2.4 next year and then 4.4 the year after. Key workers, I've got enough money for starting off this year about 640 to 800,000, and it ends up in year 3 to 1.9 million a year. That gives me to do the 40. On the intensive support, I've said to you it's about £1.5 million I'm planning a year from that money that first of all I said is growing up. Our mental health expenditure in terms of the extra transformation bits that links your crisis services. This year we got allocated about 3.8 million, goes up to 5.8, and then another 7.5 the year after. And so we got extra money, COVID monies this year. So again, every area's got basically the same as next year. So they should have about 5 or 6 million for me. So you can basically work out 6 million is roughly what I've got for a population 3 million. You can work out roughly what's in your patch. Youth justice and other bits is harder because a lot of them get quite short-term funding, but there is funding they've had around what are called collaborative commissioning networks and some of the forensic cams and some of the bits there. So well worth thinking about those elements at least and saying they're the ones I'm using to fund a lot of this stuff. That makes sense. So hopefully that helps people to try to think through. But again, the trick is getting the right people sat together, because I do think it's now coming to the fore around these crises. Fiona, is that okay for today in terms of what people want to do?
Yeah, I think that's absolutely great. Thank you so much, Sandy. If anyone has any other comments or questions, do fire away. But if not, the next workshop starts at 10 to 4. So you have a sort of a 10-minute break, but we'll just leave this open for a few more minutes in case anyone wants to ask anything else, essentially. And if anybody doesn't have their links for the next workshop, do let me know or send us an email, but I'm assuming you're going to have them because you got this far.
Almost up to time as well.